we're going to talk the different clinical manifestations and diseases that has been faced by every patients. Good day everyone, I am Jhonycel Regala, your physician in charge where every concerns, questions, and messages are all recognized here. For our case report today, a 25-year-old man sought medical attention for a nodule on his right hand that had developed about a year after returning from travel to Liberia. The nodule was surgically excised and a tangled mass of thin white worms was observed within. The worms were preserved in a 10% of formalin and sent to the Center for Disease Control for identification. For our first session, this is what we call Doc You Know. So, we can see that the patient was diagnosed with the parasite of the Onchocerca volvulus. So first, did you know what is Onchocerca volvulus? Based on the picture shown on the screen, we can see that the Onchocerca volvulus ranges in length from 150 to 355 micrometers. The one primary characteristic that distinguishes this organism from the other microfilariae is that it does not possess a sheath, wherein the body contains numerous nuclei that extend from the rounded anterior end, almost to but not including the tip of the somewhat pointed tail. So, you know that those of Onchocerca volvulus are found in the subcutaneous tissue and not on the blood specimens. So, the black genus fly Similium is responsible for transmitting the Onchocerca volvulus. An entrance into the human host and following maturation, the resulting adult worms encapsulate in subcutaneous fibrous tumors. It is here that the adults begin coiled and microfilariae emerge. For the other informations of the Onchocerca volvulus, this is commonly known as the convoluted filaria. Its pathology is the onchocerciasis or the river blindness. Habitat is on the subcutaneous tissues. Vector is the Similium fly or black fly. Mode of transmission wherein this can be transmitted by having a skin inoculation. The periodicity is non-periodic and diurnal. Specimen use are skin snips or shavings, and the infective stage is the third stage larva. Moving on to our next session, which is what we call the Anana. So let's now move on to the pathogenesis infected with the Onchocerca volvulus. So Onchocerca volvulus are diagnosed with onchocerciasis wherein it causes an eye and skin disease, severe itching, and also it can lead to permanent blindness if not treated. So removal of Onchocerca volvulus is by the manual removal or surgical removal of the worm in the affected eye. So the treatment on it is the ivermectin, wherein it is the drug of choice. Its prevention contains the personal protection, the use of mosquito nets and repellents, destruction of vector breeding areas. Lastly, on its epidemiology, it is distributed primarily in Equatorial Africa and Central Africa. Insect breeds in running water, particularly along streams and rivers. Able to learn something today about the different stages or kinds of parasites, especially in our case reports. Once again, this is your physician, Jhonycel Regala, and this show always answers the concerns and clinical manifestations of every patient diagnosed with the different pathogenesis of the parasites. Thank you and keep safe always.